So I'm really delighted today that we're going to further explore the opioid crisis from an enforcement and legal perspective. So again, thank you for coming. Just to kind of remind us that we are going to look at this opioid crisis through a comprehensive approach. We will follow the National Drug Control Strategy recommendations through evidence-based approaches, focusing on prevention, early intervention, treatment, recovery support, criminal justice reform, law enforcement, and forming strong regional partnerships. We understand the consequences of drug use affect every sector of our society and hamper the ability of our young people and adults to reach their potential. So without further ado, today we're going to hear from different perspectives from local and state law enforcement officials. Their combined experience in the legal field will be extremely valuable to us as we move forward in braiding enforcement into the work of addressing our opioid crisis. So because Fran has his PowerPoint up and ready to go, if you don't mind, we'll go off a little bit the agenda and we'll let Fran come speak to us first. So Francis Carino, SASA, and I'm not sure I know what that stands for. Supervising Assistant State's Attorney. Sorry. Was appointed as the state's first full-time prosecutor assigned to handle juvenile matters and served as the state's chief juvenile prosecutor from 1979 through 1996. In 1996, Attorney Carino became the chief state's attorney on all juvenile matters, providing support, guidance, and training to prosecutors, probation officers, judges, attorneys, and the police. He is also well known around the state for its advocacy for the juvenile review boards and teaching engagements at the University of Connecticut and Law Enforcement Council of Eastern Connecticut and the Southern Central Criminal Justice Administration. Attorney Carino has received numerous awards for his work in the field of juvenile justice, including the 2012 Lifetime Achievement Award from the Division of Criminal Justice, and is primarily responsible for writing the Connecticut version of the Play by the Rules book used in many of our schools and the juvenile law section of the Red Book Field Manual used by most police officers. So please let us welcome Fran Carino.
Thank you, Jean. Good morning.
Good morning.
Happy to be here. Just to clarify, I'm not the Chief State's Attorney. I work in the Chief State's Attorney's office. But I've been involved in the prosecution of kids for a few decades. I started year 38 last month. So that's been my area of specialty and expertise for the last several years. I appreciate the opportunity to come and speak with you this morning on this opioid issue. It's starting to actually have quite a bit of significance in the state, particularly among the young kids. And that's what I'll try to present some information about that this morning. Let me start by saying a copy of this presentation that I'm going to show you is available on my website, francarino.com. It's a no advertisement, nobody makes any money on it type of a website. I put it up primarily initially for the police to have one single source to go to for accurate, up-to-date juvenile information, but since then it's been expanded. It's available to the general public. School administrators and teachers use the site. I've had kids take information off the site to do their research papers and whatnot, so it's a very very available site for everybody, and a copy of this presentation will be there if you need to refer to it. My agency is the Division of Criminal Justice, and along with the state and local police, we're responsible for enforcing the laws that the legislature enacts. And we're also responsible for the prosecution of those kids and adults that violate the law. So that's the agency that I work for. Some facts about this particular issue. Many people become, as you probably well know, many people become addicted to drugs by starting out with some type of a relatively harmless drug that they would consider it harmless, such as marijuana, or they're starting to use prescription medication for some legitimate purpose, legitimate injury or for pain management. And then what happens is this casual or legitimate use then turns into a desire to try something else or a need to medicate, self-medicate after that prescription runs out. Oftentimes this leads to the opioid abuse or dependency that we're talking about today. Also, another source of this is a lot of times kids will get involved with marijuana, and it's relatively common. I'll show you some statistics. And what we often see happen is the kids end up working with a particular supplier for their marijuana, and then that supplier decides, well, maybe you want to try something else. Give this a try. And they'll offer sometimes even a free sample to the kids just to get them started, and that starts the entire cycle. So those are a couple of the ways that kids get into this, this abuse of these types of drugs. So what I want to cover with you this morning are these. We'll talk about kids and drug-related issues. What are the kids using? How are they using it? Where are they getting it? What are they doing after they consume the drugs? What role does social media play in all of this? Because kids today, you can't disconnect them from social media, so that plays a role in this as well. Where are the kids hiding the drugs that they're getting? What are the drug laws in Connecticut? What is law enforcement doing about this issue? And what new approaches are out there for us to take a look at? So I'll try to run through all these real quick for you. What are they using? By far, the most common drug that kids seem to be using today is the marijuana. Now, these charts that I'm going to show you are from the 2015, the latest version of the Connecticut School Health Survey Report. You can go online to the Department of Public Health and look up under the section on the left-hand side about statistics, and you'll find the Youth Risk Survey. This is a self-report that's done every couple of years in the schools, and the information is collected, and these charts are what's being published. I don't vouch for the accuracy of these things. These are self-reports by the kids. So to the extent the kids are honest when they answer the survey questions, that's where this information comes from. So on the question of have you ever used marijuana, these are the numbers. Now, the 9th, 10th, 11th, and 12th grades, those are the grades that we're looking at. The percentages you can see there. By the 12th grade, almost 50% of the kids have used marijuana. So that's how common this is. If you look at the trend, and this compares the overall percentage from year to year, at least since last year, there's been a decline. So that's going in the right direction. But I'm not sure just one year makes a trend. But at least starting this year is starting to go in the right direction. When you look at when kids are using marijuana for the first time, this question asks who tried marijuana before age 13? And again, seems like a relatively small number. Overall average 5.8% of the 4 grades. And again, when you look at the annual trend compared to last year, it's down a little bit, so it's going again in the right direction. The kids maybe aren't starting to smoke marijuana as early as they used to. This is the percentage of students who currently use marijuana. I think that was defined as you used it within the last 30 days. Again, almost 30% of the kids, by the time they reach 12th grade, are using this stuff. And again, as I said before, with that much contact with marijuana suppliers, they're increasing their possible exposure to more serious drugs through that supplier. And again, if you look at the trend over the last few years, at least since last year, again, we have it going in the right direction, going down. They're also getting involved in this form of marijuana, the so-called synthetic marijuana. It'll come out of Spice, K2, Scooby Snacks. What's difficult from a law enforcement perspective is the legislature can identify the specific components of a drug and make those components illegal. But the synthetic marijuana, there's no specialized formula for it. And so Spice might be a little bit different formula than K2, and just when the legislature gets around to identifying those specific substances that they're going to make illegal, somebody makes a different combination and it doesn't technically fall under the statute. Plus, it's really hard to figure out what's in this stuff. When you look at the back of these packages, there isn't a breakdown of the ingredients like there is in any other type of a food product. So it's very hard to determine exactly what's in these things. So it makes it difficult from a law enforcement perspective. It also makes it very difficult from a safety perspective, because the kids are consuming this stuff without really knowing what's in it. And that can be an issue, a problem at some point. Here's the reaction that a person has to this. This comes from Day Kimball Hospital, which is a big hospital in eastern Connecticut, their emergency room. The doctors there say, what we've seen in terms of reaction to this drug, synthetic marijuana, has been profound. Patients have been coming in with hypertension, rapid heartbeats, nausea, vomiting, difficulty breathing, and chest pains. Their vital signs can be off the charts. Patients can be completely confused or violent. Usually somebody using marijuana is typically more sedate. This is Dr. Miro from the hospital. With synthetics, it's completely the opposite. They're violent, they're thrashing about, they're frightened, they don't know what's happening to them. It's awful to see. When I train police recruits, I inform them that, look, these are the symptoms. If you encounter somebody with these type of symptoms, consider the fact that they may be on synthetic marijuana. If you look at the statistics, how many are using this synthetic marijuana, again, seems like a relatively small amount, but it's out there and the kids are being exposed to it. Getting away from marijuana to the other illegal drugs, this is cocaine. Percentage of students who use cocaine anytime. Relatively small percentage, again, if the numbers are credible. But still, 6.7% of 12th graders have used cocaine. When you look at the percentage over the years, again, this has been a little bit better downward trend since 2009, and it continues to go in the right direction. This is the question about methamphetamines. Now, I was a little bit surprised by this because I didn't think we had too much methamphetamines here in Connecticut, but apparently it's out there. The numbers are relatively low, but when I show you the numbers for heroin, methamphetamine numbers are actually higher than heroin, which makes me question the validity of some of these statistics. But these are, again, self-reports by the kids. The trend, again, since last year anyway, with the use of methamphetamines has been going down, right direction. Ecstasy, another party drug that the kids are exposed to. You can see the numbers, a little bit higher, especially among the 12th graders. By the time they're getting into 12th grade, over 7% of the kids have been taking ecstasy. And again, generally this is at parties that kids are taking this. The trend here, again, since last year, going down slightly, so at least it's in the right direction since last year. And here's the heroin, which we can hear a lot about in the news media. These numbers seem really small compared to the anecdotal information that we read about in the newspapers and hear on the news. But these are the numbers that the kids are reporting. And again, the percentages of use since last year is going in the right direction. Again, if 1 year is going to make a trend, we'll have to see what happens next time. These statistics are put out by the chief medical examiner. These are not just kids, these are all adults and kids. Chief medical examiner is responsible for determining cause of death and whatnot in any type of an untimely death situation. So these are the numbers put out by the chief's office as recently as this year. And take a look at them because they're kind of disturbing. 2012, they reported 357 total accidental drug intoxication deaths in the state. That's from all different types of drugs, total 357 in 2012. By 2015, that number jumped up to 729, which is a substantial increase. But when you look at just the first 3 months of 2016, the number is already 208. So they're projecting for 2016 the number will go up to 832. That represents a 233% increase since 2012 in 4 years. There were 416 heroin-related deaths in Connecticut in 2015, 110 of which were just heroin, 108 were heroin mixed with fentanyl, and another 106 were heroin with cocaine. When we're talking about fentanyl, which is relatively new on the scene, this is what the U.S. Attorney for Connecticut is saying. She said fentanyl is a highly dangerous synthetic opioid which can be up to 50 times more potent than heroin. In the wrong hands, it's deadly. Here in Connecticut, like other parts of the country, we're battling an escalating epidemic of opioid abuse. She's the U.S. Attorney for this district. Approximately 3 to 4 grains of fentanyl, which is similar to the size of a grain of sand or salt, can kill a person. The street value of fentanyl is $100 a gram, 1,000 grams in a kilogram, so that means $100,000 per kilogram. Big money involved when you're moving fentanyl. Going back to the statistics, in 2015, fentanyl was involved in 80 other than non-heroin related deaths. 31 involved just fentanyl, 43 showed fentanyl and cocaine in the bloodstream, and 23 were a mix of fentanyl and prescription opioids. From January 1 to March 31st of this year, 110 heroin-related deaths, 26 were just heroin, 39 were heroin and fentanyl, 26 were heroin and cocaine. There were 47 other fentanyl-related deaths that did not involve heroin. So that's showing you how common this fentanyl is starting to become. By the end of 2016, they're estimating, based on current statistics, that there'll be a 76% increase in deaths related to fentanyl compared to 2015, 188 to 332. When you go back and compare it with 2012, that's a 2,300% increase, going from 14 to 332. That's the concern. As if fentanyl wasn't bad enough, there's something called W18 out there. Not sure if it's in Connecticut yet, but inevitably it'll get here. It's popping up in parts of New England now. It's a white powder, similar to heroin or fentanyl. Fentanyl, as we said, is 50 times more potent than heroin. W18 is 100 times more potent than fentanyl, and 10,000 times more potent than morphine, which is a pain reliever. It's similar to drugs used to tranquilize large animals like bears and elephants. So you can imagine the impact it would have on a kid that weighs 150 pounds, or an adult that weighs 250 pounds even. There were 2 fatal W18 overdoses recently in Massachusetts. It's just a matter of time until it shows up here if it hasn't already. Dr. Allen from the Rushford Center said fentanyl was on the scene last year and led to a big increase in overdose deaths. He's concerned about it. And because the DEA is not even regulating some of these drugs, there's very little that can be done about it. So it's out there and it's circulating around and it's bound to come here. Getting away now from the illegal drugs. Kids are involved with inhalants, sniffing glue, sniffing aerosol containers, paint, things like that. You don't even have to break the law to buy this stuff. It seems like it's relatively high in the younger age. Ninth graders, 7.8% are involved with this. Maybe because of the ease with which it can be obtained. I'm not sure, but those are the numbers. And again, over a more consistent period of time, the use of inhalants seems to be going down, which is a good sign. Prescription drugs. Now, these are kids who took prescription drugs without the doctor's prescription. So either they're taking somebody else's prescription drugs, somebody else at school, or maybe their parents, or their prescription drugs were given to them and then the condition disappeared and there were prescription drugs left over, so they continued to take them without a doctor's prescription. These numbers are relatively significant. And these are the types of things that could result in an opioid abuse later. Kid starts out on the prescription drugs for a legitimate purpose and then decides, I want to continue feeling that I got when I took those drugs, and so they continue to take the drugs until the prescription runs out. Now you've got to replace that with something else. And you can't just go to the drugstore if you're 15 years old and say, I need some more of this prescription. It's not going to work. But if somebody is available that can provide you with other illegal substances to take the place of it, the kid might be likely to do that. Over-the-counter drugs. This is your cough syrup, your over-the-counter pain relievers, taking enough of these to get high. Again, the numbers are significant, and this could also lead to opioid abuse later. The over-the-counter drugs seem to be going down again from last year. Significant drop in 1 year. How are they using this? Well, it's not your grandfather's marijuana anymore. It comes in all different forms. This is like little gummy bear types of fruit is available, and it's got the THC, the marijuana components in it. It comes in candy form. It comes in baked goods. Again, sour gummy bears. Those look an awful lot like the sour gummy bears you'd buy anywhere else, but these are THC-laced treats. Pop-Tarts. So when parents see the kid taking a box of Pop-Tarts to school, you better take a close look at that box, because that looks an awful lot like a Pop-Tart box. And if you look at it closely, obviously it isn't. Pot-Tarts is what it's called, and it's marijuana. And when you kids have those Snapple and Gatorade bottles that they're bringing to school, take a look at what's inside them. It may be this type of a drink, which is, again, has the THC in it. As far as injecting drugs, very low percentage. Kids are still a little reluctant to put a needle in their arm to take the drugs, but with all the other opportunities to consume drugs, you really don't need to inject them. So there's not a high percentage of kids involved in that. Where are they getting these drugs? Back in my day, this is where you had to get your drugs. Some dark alley, some shady character. You don't know if you're going to walk out of the place. That's where drugs were sold before. Times have changed. This isn't the case anymore. Look at this chart. Percentage of high school students who are offered, sold, or given an illegal drug on school property. We're sending kids to school to learn, presumably in a safe environment, and they're being offered, sold, or given illegal drugs. Look at these percentages. Almost a third of the kids at school are being exposed to illegal drugs at school, on school property. And this is going in the wrong direction. uptick since last time the survey was done. Or just go online, Google the words buy drugs, and you get a whole list of places where you can buy drugs. There's a part of the internet called the dark net, which you can buy all kinds of illegal stuff on there, and there's instructions on how to access it and how to use it. What are the kids doing with the drugs after they take them, other than driving? I say other than driving because driving is bad enough. I was just at a conference yesterday. We were told that the driving under the influence of alcohol cases seem to be going down. But what we're seeing an increase is the driving under the influence of drugs. And so putting drugs aside, putting driving aside, because a lot of these kids may not even be old enough to drive, putting that aside, what are they doing after they're taking the drugs? Well, in this situation here, they're going to school. There's a number of kids who attended school under the influence of alcohol or other illegal drugs. Again, the numbers are significant. Over 13% have gone to school under the influence of alcohol and drugs. What kind of a learning environment is that going to create when the kids are high or drunk when they're going to school? And again, this, at least from 2013, going in the right direction, but I'm not sure you can draw any conclusions just not based on that 2-year comparison. This one here asks how many kids drank alcohol or used drugs before last sexual intercourse. Again, the numbers are pretty significant. I classify this as risky behavior following risky behavior. It's tough enough for kids in this age group to make right decisions when it comes to this type of conduct, but to do it under the influence of alcohol and drugs, it's got to be even worse. This is going in the wrong direction 2 years in a row. What role does social media play? Again, you know the connection between kids and social media. What social media is doing is it's introducing unsuspecting kids to the drug culture. It's glamorizing the use and effects of alcohol and drugs. It's enhancing the influence of their pop culture idols, which they worship. It gives the appearance that everybody's doing it. It provides encouragement and instructions on the use of drugs, because it'll actually tell you how to make hash oil. Just go on YouTube and there's a video and show you how to do it. It provides access to illegal substances. I just showed you how to buy drugs online. And it directs children to use social events where drugs will be available and or used. So these are all the things that social media does to make this situation of drug abuse by kids even more significant. Where are they hiding it? You might find this interesting. This is a battery, looks like a battery, 6-volt battery, but it comes apart. It's not really a battery, and you can store drugs in there. Hairbrush. You see where money is stored inside the hairbrush. You can store anything in there, drugs, whatever. Barbasol can. That's not really a can of shaving cream. They call it a safe. And these are legitimately sold, so when you're traveling, you might put your valuables in that, so if somebody broke into your suitcase, they wouldn't think that had anything valuable in it. They would think it's a can of shaving cream, but it isn't. But what the kids use it for is to stash their drugs at home, so nobody can question it. Speed Stick deodorant, WD-40. Again, you see the false bottom, and the items are stuffed inside. Morton Salt, Del Monte Fruit Cocktail. Notice what it says right in the ad. Made from genuine product containers. So that's really a can of fruit cocktail, but there's no fruit cocktail in it. The bottom unscrews, and you can stuff things inside it. Notice what it says under that. Screw off bottom, practical gift for any occasion, perfect for home, office, school, travel, RVs, and boats. The best place to hide anything is in plain sight. So you stick the drugs in there, you stick whatever in there, and nobody's going to know. English Dictionary actually has a locked section inside of it. If you put that on a bookshelf, you can't tell the difference. An Aquafina bottle, that looks like it has water in it. It does. On the top half. The bottom half unscrews, and you can stuff all kinds of stuff in there and nobody can see it. All these things I just showed you are available on Amazon.com. So if a kid wants them, they can get them. Parents, school people, watch out, because you'll see kids with this and you may not think twice. You have to check everything. As far as what the drug laws say, 2011, legislature decided to decriminalize the possession of under ½ ounce of marijuana or related drug paraphernalia. The idea was, well, it's such a common offense that's occurring. We don't want to make everybody a felon, so they made it a less than a felony for persons over the age of 18. If you're an adult, you pay a fine. If you're a kid, it's still a delinquent act. It could be handled in juvenile court, but it's not a felony anymore. And for an adult, it's not even a crime. It's an infraction or a violation for which you pay a fine. But a juvenile could still be committed to DCF for up to 18 months. The message is that possession of under half ounce of marijuana is not legal. It's just that it won't get you incarcerated if you're an adult. But it sends a confusing picture to the kids. Because kids are hearing, on the one hand, for adults, it's not a crime. And so how bad could it be? They're hearing medical marijuana. If it's good for grandma and her eye condition, then how bad could it be? Can't be that serious. So it's medicine. And they're seeing people in other states where recreational use of marijuana has been passed. They're saying, well, how come it's bad in Connecticut but not in Colorado? And so it sends a very confusing message to the kids. There are motor vehicle consequences also for these marijuana charges. If you're under 21 and you get convicted or you pay a fine for the possession of under half ounce of marijuana or related drug paraphernalia, you end up losing your license for 60 days. If you have a license, if you don't have a license, your ability to get a license is delayed by 150 days. And you can bet your insurance, your car insurance is going to go up as a result of that suspension. New law was passed in 2015. Again, the idea is we shouldn't be putting people in prison just because they're using drugs or possessing drugs. Well, whether you agree with that politically or not, that's a different issue. But the law changed in 2015 so that possession of any quantity of any controlled substance other than the under half ounce of marijuana, because that's not even a crime, is now going to be a misdemeanor, no longer a felony charge. So the penalty has gone down substantially for possession of any controlled substance, any quantity. And possession of any controlled substance within 1,500 feet of a school is also no longer a felony, it's just a Class A misdemeanor. Another law was passed this year, 2016, is Public Act 1643, probably takes effect in October of this year. And some of these concepts I think make sense. They're limiting the amount of opioid drugs that can be prescribed by a doctor, 7-day supply maximum for a minor, or for the first time the adult gets that prescription. So they're limiting the amount of pills that are going to be out there. It's going to require consultation with a minor and a parent about risks and dangers of those drugs before they're prescribed. There are going to be some changes in the electronic drug monitoring program requiring quicker reporting and record review so that if one doctor does the prescription, if another doctor is going to also give a prescription, they can know what's been prescribed. It allows licensed healthcare professionals to administer an opioid antagonist, that's your Narcan. It's becoming popular now for EMS and police to use. Requires local EMS responders to be equipped and trained to administer such antagonists, and prohibits insurance policies from requiring prior authorization for the use of those drugs. So those are probably good things to address this issue. What's law enforcement doing? Well, law enforcement's doing what law enforcement can do. There's not a whole lot we can do to stop the problem except things like this. This was May, just last month. This was in Tolland. Police stopped a car for motor vehicle offenses and found that the operator was in possession of counterfeit credit cards, fraudulent driver's license. He had 20 envelopes containing butane hash oil, which is a very highly concentrated oil that's used to get high, and 24 plastic foil bags containing 1.7 pounds of medical cannabis brownies. Must have had a serious pain problem, I suppose, to require that many brownies, but you can see him in the picture there with all the money that was seized. Also, May of last year in Stratford, they arrested this guy. Take a look at what he had. They stopped him again, motor vehicle stop, which is a common situation. Stopped the car. They had a tip that there might be narcotics in the car, so they bring in a drug-sniffing dog. The dog does its thing, and what they found was 28 pounds of heroin, having a street value of about $1 million in the car. He was charged with, you can see what the charges were, held on $1 million bond to appear in court. He had $1 million worth of drugs in his car. This is a federal arrest. 9 people arrested on federal charges with fentanyl distribution. And again, this is the U.S. attorney. And again, they're concerned with this type of situation. They ended up charging these people, these 9 people. 2 of them were charged with conspiracy to distribute, conspiracy to possess with intent to distribute 400 grams or more of fentanyl, mandatory minimum sentence in federal prison of 10 years, maximum of life. So if they're convicted, they'll get at least 10 years in prison. A third of that group was charged with, a third person was charged with possession with intent to distribute, and 6 others were charged with conspiracy to distribute and possess with intent to distribute controlled substances. They're looking at up to 20 years in federal prison for those charges. So the courts mean business when these people do get arrested. What other initiatives are out there to try to deal with this problem? Because Enfield's not the only community looking at these issues. The U.S. Attorney, which is the federal prosecutor, our office, the Chief State's Attorney's Office, and DEA, the Federal Drug Enforcement Agency, they're working together now on a program with local police so that when local police respond to a fatal overdose, they don't just treat that as an untimely death. They investigate it as a crime scene and preserve the evidence and do everything that they would as if it were a crime scene. DEA then comes in to determine where the drugs came from that ultimately caused the death of this individual. And then they look into that situation, do an investigation. If they can establish that the person that supplied the drugs knew or should have known that those drugs could have a fatal impact on somebody who took them, then that person will be charged in the federal system with some pretty serious charges, not just distribution of narcotics, but charges up to manslaughter, causing the death of that person. So that's the approach that this united group of state, local, and federal law enforcement agencies are going to attempt to try. This is Waterbury. They have a task force in Waterbury because they've had, as you can see, a number of situations where they've had problems with opioid abuse. So they're putting together a program, bringing in former addicts to talk to kids and adults about addiction. They're also putting trained police officers who are good at providing instruction to kids because they've got experience and training in that. They're going into the schools to talk to the kids. And Mayor O'Leary is saying to any other community such as Enfield, if you want to come in and sit in on one of our task force meetings, you're welcome to do so and see what we're doing to address the problem. So there are some novel ideas out there, that there are people looking at this situation and trying to address the issue. The state of Connecticut, we're all about protecting the lives of our young people, particularly when it comes to drugs and alcohol, but the police and the courts can't do it all. Parents and kids need to be educated about the law and the signs of substance abuse. Parents need to supervise their kids and set a good example. It's hard to tell a kid, don't smoke marijuana if the parents are smoking marijuana. And kids need to act responsibly and be a good friend. When they see a friend at a party or after school starting to get involved with this stuff, they have to speak up and be a good friend. And that's my contact information. Any questions? Yes, sir.
Kind of a comment and a question. One comment, you talk about where kids are getting these drugs. One thing that wasn't up there is getting them from home. A lot of people that have been stockpiling, not with bad intentions, but they're prescribed opiate pills.
Yep.
And then they're sitting around in all our medicine cabinets, and kids are getting access to those and either using them or selling them at school. And
Yep.
so it's real important that we encourage people to get rid of old drugs.
Yeah, that's why we have the
Police
periodic.
departments now are safely collecting them. And another question was about your statistics about the different drug use in teens, and you didn't have a statistic for alcohol. How, you said marijuana is the most common. How does that compare to alcohol use in teens?
Just did a program like this on alcohol, about a month ago. Yeah, this one was just on the drugs, so I don't have the alcohol
So I'm
statistics.
just wondering how it compares to prevalence of use.
I don't recall the comparison between the two, but it's probably just as big of a problem.
It's a little higher.
A little higher? Okay. You're right about where kids get it. The medicine cabinet is probably the most common place. Because, and that's why this 2016 law was meant to address the overprescription. So if you only need a couple of pills, it's all you should get is a couple of pills, not a whole bottle full of pills. And again, parents' responsibility, if there's extra pills left over from their prescription or the kid's prescription, get rid of them. But yeah, or when the kid goes to visit grandma. Grandma's on a medical marijuana certificate, she's getting 2.5 ounces of marijuana every month, and she's not using it. It's piling up in her bedroom or in her bathroom medicine cabinet. And the kids know what's there, so grandma's not gonna miss a little bit of it. And that's what happens. We've even been advised of situations where somebody's having an open house, they're selling their house. Real estate agent brings people in there. If there's a kid, medicine cabinet's there, so you gotta be careful even in that situation. If you have friends or family over the house, hide the medication. I mentioned at the alcohol abuse program that we did, that the law requires people to safely store their firearms. And you can be charged with a crime for failure to store a firearm adequately if somebody takes that firearm and commits a crime with it. There's no such law that I'm aware of about safely storing alcohol or drugs. Probably should be. Should be some responsibility for that. Any other questions?
Okay. All right. Thank you, Fran, for coming to Enfield and sharing the most informative presentation for us. Now we're going to invite our own Captain Fred Hall up to hear kind of from a local perspective what they're seeing in terms of the opioid crisis in our community, what they're doing in terms of combating the issue, resources they might have, ideas, how we might sort of move forward on a regional approach. So I'm delighted to bring Captain Hall up. He's been working for the Enfield Police Department for 28 years, and he was promoted to captain in 2011. But I just want to say Captain Hall has been most innovative and compassionate and caring for all citizens across the lifespan. I can't think of a better partner when we look to him to be involved in our juvenile sort of diversion program, running the Juvenile Review Board, to our early intervention team, to our crisis response team, to helping reduce our school-based arrest and looking at other disciplinary things when it's a school disruptive behavior versus taking a more enforcement approach. So Captain, you've been a champion for prevention, and I can't thank you enough for working with us. So please welcome Captain Hall.
Good morning, everybody.
Good morning.
My name's Fred, by the way. So, listen, I'm here to give you a local perspective, the perspective from Enfield. Can everybody hear me? I'm not a big microphone person, so if it's okay with everybody, I'll just talk like this.
It
Is
won't
that
get
fair?
picked up on TV.
Oh,
Sorry.
all right. TV's important. All right.
TV's important. Are you happy with that?
So let me try that.
Okay.
All right, so I'm here to share with you the local perspective, what's happening at Enfield. I'll give you some tangible facts, I'll give you my opinions on what's going on, what we're trying to do to prevent that problem. I've been fortunate enough to work narcotics a big part of my career, so I'll share with you my experiences. I'm in no way a subject matter expert. I think the most important thing we can do as a community is all of us to get involved, and I think education is the key. Far too often, and I think Fran alluded to this, by the time law enforcement gets involved, it's gone too far downstream to be fixed quickly. So, any questions you have, feel free to answer them. If I can answer them, I'll answer them. If not, there's other people in the room, I'm sure they can. Tangible facts. Last 18 months in Enfield, Connecticut, we've had at least 17 heroin or fentanyl-related deaths. So we're looking at almost every month a death related to heroin or fentanyl. In that same time period, we've had 65 applications of Narcan to our citizens. So in 18 months, you're looking at almost every week somebody's getting Narcan. Everybody familiar with what Narcan is? So Narcan is an antagonist to an opioid. It's done intranasally. It's administered intranasally, and it takes people out of their opiate high, brings them back to life, if you will. It's not uncommon to find a person who's blue and with respirations at 3 or 4 a minute to take Narcan and to come back. It's an amazing drug. It's an important thing, and it's a great tool in the fight on this. As Fran alluded to, it's easier to get now. Going to your doctor or to a pharmacist now, you can get Narcan prescribed without much effort. Law of unintended outcomes. Unfortunately, now we're experiencing where we go to houses where they have Narcan on hand, and it becomes a false safety blanket. So Narcan's on hand, people feel freer to use more heroin or more opiates, thinking they have this safety blanket. And it just doesn't get administered on time, or it doesn't get administered at all. So although a great tool, it is not a cure-all, fix-all. What are we doing in town to combat this? We've taken a really broad approach to combating it. We don't think that law enforcement is the only way to do this. In fact, we know law enforcement is not the only way to do this. So we've taken to educating the public, which I think is very important. We have a couple of officers who are, one of our canine officers are passive, or drug dog, and one of Officer Ant, another one of our officers, a great guy who put up PowerPoint presentations and go to schools and teach nurses and any civic organization that wants to know about opiate abuse, signs and symptoms, paraphernalia, that stuff to look for. they're more than willing to come out. And I tell you that because if you need that, get a hold of me or get a hold of Gene, and we'll get those guys out to you. Personally, the most important thing we can do is have those guys out there, because I believe most of the time people are seeing paraphernalia or signs and symptoms and just don't recognize what they're seeing. Some of the stuff is so innocuous that in and of itself, if you saw it without knowing that it was associated with drug abuse, you wouldn't make the connection. Knowing that it's associated with drug abuse, you could make the connection and get help earlier, be that through insurance, counselors, rehabs, or the police if you have to. So I throw that out to you because I want you to take advantage of it. I really need you to take advantage of that. We can't do this on our own. If you have a civic organization, churches, schools, any kind of club, and you want to have some information about that, by all means, get a hold of us. We'll get them out to you. We also have a very aggressive drug take-back program, which again is huge because for the longest time we saw almost a script. I can tell you that not on a daily basis, but not a few days didn't pass where somebody wouldn't come to the front desk. We wouldn't have this conversation about a friend, family member who had a serious opiate problem, and the opiate problem started with either a legitimate injury where they were prescribed pain medicine, or somebody in their family had a legitimate injury and people were taking the drugs. And then sooner or later that prescription runs out, and that's where we start seeing associated criminal behavior. People either forging prescriptions, going to a friend's house to steal prescriptions. It should be a fairly uncommon situation where somebody comes to your house and says, hey, I've got a back problem, can I borrow some pain meds? That should be a red flag that goes up. Unfortunately, friends and family are quick to give that kind of stuff. Oh yeah, I have extras, you're more than welcome to have some. And that should be a red flag. We saw a lot of that. It was almost a script on a, not daily basis, but often enough that it became a true concern. And this is also for you folks to know, we have the green box in our front lobby. We don't check, it's supposed to be for residents of Enfield. We don't really care if you're not a resident of Enfield. Most police stations either have or will have these soon. It's a drug take-back box. Come in and it's anonymous, drop the drugs off. We collect the drugs and incinerate them 3-4 times a year. To date, we've had about 1,200 pounds of drugs destroyed. That's a lot of drugs. Now, not all of those are opiates, I'll tell you, because we don't screen them. The only thing we don't take is syringes or liquids. But everything else we take. So it's not uncommon for us to get vitamins and aspirin and all kinds of stuff. We don't care. If people are cleaning out their medicine box, that's the end goal of what we're looking for. If you have some drugs at your house, it's not uncommon for people when a loved one has been hospitalized to have dispenser containers full of opiates to come in and drop them off. Great thing to do, get them out of your houses, take that avenue away from people who may be inclined to use or abuse. We work with social services as much as we can, whenever we can. They just sponsored a drug take-back day on Saturday. Unfortunately, it got rained out. I'll tell you, it got rained out, so we had 2 hours of a drug take-back day. Balloons in front of the PD. Great event. About 60 pounds of drugs in 2 hours. The Enfield Together Coalition advertised the heck out of it. We got a lot of folks to come in and deliver that kind of stuff. We work together on a bunch of task force because there's an interrelation between all of this stuff, and we pass this out to everybody. Some of the task force are youth in crisis, adults in crisis, that kind of stuff. There's an overlap in all of this stuff, so the more you get involved in your community, the easier it is, the more effective we can be in the community. The last part of this is Enfield. We have a very aggressive enforcement standpoint. At some point or another, the criminal activity will get so bad that it draws the attention of law enforcement. And quite honestly, some people need to be arrested. Some people need to go to jail. And I tell you that both from a humanistic standpoint and from a law enforcement standpoint. From the humanistic standpoint, sometimes the best thing that can happen, and keep this in your back pocket, is that they go to jail where they physically and psychologically dry out from the drugs. One of the unintended consequences of the legislature making possession of illegal drugs, or cocaine, heroin, methamphetamine, a misdemeanor, is that now if they're not selling, if they're caught within possession with intent to sell or in the act of selling, the likelihood that they're going to go to jail is very, very much diminished. The problem is that takes the stick away from the courts to make them go to rehab, and they have to go to rehab. Long-term inpatient rehab is very important. So not only does Enfield have an aggressive posture, but we've recently joined with East Windsor, Windsor Locks, and Suffield to do a regional task force. We've got top shelf officers on the task force. They're working their tails off. I got to tell you, they've done some great work in the 4 months that they've been together. I don't have all the statistics for you, but I can tell you they were with the DEA when they did the fentanyl lab, and the fentanyl lab was on a nice residential street here in town. Kind of eye-opening. Last week they took 1,200 bags of heroin off the street and 2 ounces of uncut heroin off the street. That's huge, because you're looking at about a 2,500 bag seizure of heroin. That's a lot of heroin. And I'll tell you, my opinion of the scope of the problem is this. 20 years ago, to have an ounce of heroin, you needed to be a made guy out of New York City. You needed to have connections. Not the case anymore. Distribution is such, and all of it's coming from China, Mexico, overseas. We have distribution hubs, one of them being Springfield with the bus route here, that getting ounces of heroin now is not a problem. It's not a big deal. That's a lot of heroin when you consider that it's doled out in 1/10 gram increments. That's dangerous stuff. So, again, just to recap, whatever we can do to help you folks, please take advantage of the programs we have. We would like to take advantage of you. If you have information, please call us and let us know. Again, there's a silver lining to the dark cloud of law enforcement. Sometimes people need to get arrested because they need to have a place where they can dry out physically and psychologically and be forced to go to rehabilitation. What did I miss?
No, good.
Anything? Did that all in one breath, not bad, right? Sure.
Are you familiar with the Volunteer Angel program that was started in Gloucester, Mass?
I am.
With the police department. Do you have any thoughts on that?
I do have some thoughts on that. The first thought is it's a novel and interesting program, and we looked into it, to be quite honest with you. The obstacles that we run into is that we don't know how we could make that program work from a personnel standpoint. We're already down people, so to dedicate the people that would need to make that program successful. For you folks to understand what's going on, Gloucester, Massachusetts started a program where the chief said, listen, if you have drugs and you bring the drugs into the station, we won't arrest you, we will get you into a rehabilitation program. And it's a little more complicated than that, but in a nutshell, that's what it is. Great idea, right? In Connecticut now, we don't know that we have the authority that if somebody walks in with a handful of drugs, not to make the arrest. And then where do we draw the boundaries if we stop somebody and they say, hey, listen, by the way, I've got drugs, I've got an ounce of heroin here, does that become amnesty? So we're not sure how to facilitate that. And more importantly, or as importantly, I would say, we're 20% down. Our staffing is low. So how do we dedicate the amount of people that are needed to make that program work? We just don't have the answer for that right now.
You need to
I need to bring this up more? I'm sorry. Anybody else, anything? It's been an honor. Thanks, folks.
Thank you, Fred, for that. So now we're delighted to have Chief Thomas Dovrian, am I saying that right? Davrin. He's the Groton Police Department chief. He's been there for over 35 years, or he's been in law enforcement for 35 years. He's worked 27 years with the Connecticut State Police, where he retired as a colonel deputy commissioner. Chief Davrin is currently the chief of police in Groton, and he's going to talk more about the Perry approach, which you just mentioned out of Massachusetts. So thank you for giving us some ideas of what you're doing in Groton and how we might take a broader look at more non-traditional policing practices. So thank you.
Thank you. Yes, yeah, we have the Narcan, we have the drug drop boxes. We own the water company, so we thought it would be a good idea to have a drug box, and we take probably 200 pounds a month of drugs in. And again, we don't know what percentage that is vitamins versus other stuff, but a lot of folks bring in a lot of drugs, and we're a relatively small community for that. But what I'm really here to talk about today is the Perry Initiative, the Police Assisted Addiction Recovery Initiative that was championed and founded by Chief Leonard Campanello from Gloucester PD. And when Chief Campanello came down to talk to us in Groton about his program, he recognized that, you can't arrest your way out of this opioid problem, that maybe they should provide an alternative to help find people placement. And a lot of times when people go to the hospital, there's social services and things of that nature, but we found that the hospitals sometimes call around their list of people that could take these folks in for treatment, and a bed may not be available, or they'd give the person the list and they'd send them out the door and say, keep calling and you might get in to these places. So he wanted a little more aggressive approach where we didn't give up necessarily, because he found that if you call around and you call these places and then you wait 2 hours and call again, you might find that somebody left against medical advice and now there's a bed available where there wasn't a bed available an hour or two earlier. We also, there's a magic number there too for insurance purposes, age 26. So if the person's under age 26 and they're on their parents' insurance, it's a lot easier to get placement than if they're not. Gloucester has been involved long enough now in the program where they have what they call golden tickets. So they do have like scholarship treatment options available to them. People don't have insurance, and they've been graciously made that available to us too. But we have to husband those resources and make sure we offer them to people who have a reasonable chance of success, because you don't want to waste a treatment initiative on someone who may not be fully committed to doing the program. There's also another portion of the Gloucester initiative where they have an amnesty clause in their policy, and the captain mentioned that too. And that's we don't know what the problem is with that. And but I'll tell you, there is a problem in Massachusetts with offering amnesty for people walking in the door with drugs. And Gloucester chief said, "Well, I don't really care. I think it's more important we do this." And in Connecticut, there's a problem with that too. And so we don't offer amnesty in Connecticut, at least in Groton, for the drugs. But we did, before we wrote the policy, we actually did some research, and we asked Gloucester how many people showed up with drugs to turn in their drugs and ask for treatment help. And the answer is none. Nobody has yet done that up in Gloucester. So it's really not an issue. If you have drugs, you're going to use them. And if you have, there isn't a family that this opioid problem hasn't touched in some way. Every family has it, and if a family tells you they haven't been touched by it, then they're just not unaware, or they're not being truthful. It's because there is a stigma, obviously, attached to this. And we talked about the medicine cabinets, but it's fascinating to listen to addicted folks talk, and they'll tell you, like, hey, if I love you, you love me, and I'm using, and my lips are moving, I'm lying to you. And if you think when I use your bathroom I don't go through your medicine cabinet, think again, because I am. And Fran talked about open houses, real estate open houses, like they're cleaning you out nowadays. People go to open houses just to go through the medicine cabinets, things of that nature. So we found that the most important part of the Perry initiative is to have the angel group, as Gloucester calls them, the angels are their volunteers that help get these folks placed. So what does the police department offer? Well, we offer a 24-hour day open front door, where if you walk in the front door and you say, I'm an addict and I want to get clean, I need some help finding a place to be placed, we say, hold on there. We do run your record check, because it's not a get out of jail free card, right? So if we stop you and you got drugs on you, you can't claim like, well, I was on my way in to get help. It's not a get out of jail free card. No, you have to deal with that criminal justice issue before you get help. But if you do that, if you go to court, you get arrested on the warrants that you're outstanding and that type of thing, once you get that settled, you want help, come on in, we will help you. And how do we do that? Well, we call our angels, and our volunteer group. We have a group in the Groton area called Community Speaks Out. Very dedicated bunch of people, a lot of families that have experienced the opioid addiction issues, opioid fatality issues, and we will make a room available to them, and they come in, they'll take you inside, and they will make calls, and they'll stay with you, and if it takes 6-7 hours, they'll find a place for you. So what's the additional role for us? It's like, well, if I got to drive somebody to TF Green Airport in Warwick or Bradley to get you on a flight to Florida or California, wherever they can get you a bed, then we'll do that. We'll take that. We don't let the volunteers do that. So Now, I gotta tell you, it's not, to me to say that sounds like a big commitment, but we haven't had to do that yet, you know, so I don't think the commitment, if I have to do it once, twice, 3 times a year, that's not a big deal, you know, to do that for folks. So we provide, you know, again, 24-hour day, safe environment. We've got to protect our volunteers that do this. But if you don't have the volunteer group to do this for you, to help you with this, it's very difficult to get this program off the ground. Now, Gloucester is so sophisticated now. They've helped so many people that their duty sergeants can actually find a placement in about 15 minutes when somebody walks in. They actually don't call in the angels all that often anymore. They just, the duty sergeant knows. I deal with four rehabs. We have found that the rehabs, because you know, anything involving addiction, substance abuse, or mental health issues have relatively high co-pays on the insurance. We can get those co-pays waived. So that's another big hurdle for the family not to have to deal with. You know, if it's a $500 co-pay, $400 co-pay, you know, this is obviously lucrative business for these facilities, and they're willing to waive this to have a feeder operation sending patients to them. So, you know, obviously we take advantage of that business model that they choose, and if they want to waive the copay, we'll put them on the top of our provider list, and so we do that. But now, how many people do we help? Well, it's hard to say because we have the cards for the Community Speaks Out folks. All the officers have the cards. We have an awful lot of people. We deal with the families a lot. The families are the ones who come to us as, my son, my daughter, my nephew has an addiction problem, and I don't know what to do. So we give them the Community Speaks Out card. It says, like, well, call these folks and they'll help you. Now, we know that they get back because the founders of Community Speaks Out, you know, we interact with them almost on a weekly basis administratively. In other words, we run into each other all the time. We say, how's things going? So, well, we got this call, that call. It's very confidential. We don't know. We don't keep any records, by the way. We don't run a CAD entry on you. We don't log you in if you come to the police department, things of that nature. And we're following the Gloucester model. It's nothing to FOI. If you ask us how many people we help, we say we don't know. And we truly don't know. Because we don't know how many people that we refer to Community Speaks Out that reach out, the family members do reach out to Community Speaks Out. They may not come to the police department, so they'll set up, they'll go to the library, to the meeting room, or the senior center, or they'll meet them in the coffee shop. And a lot of times that's where the issue happens there. But I see the cards disappearing, so I do know that folks are being helped. And the folks will tell me that, you know, well, we got a referral from one of your officers, you know, we took care of that person. So again, we don't know. It's very confidential. And I like that aspect of it. I think folks like it. I don't know if everybody appreciates that aspect of it, but it's not, you know, everything we do in government is FOIable, freedom of information. You know, anybody can ask anything. But we don't keep records on this stuff. Gloucester actually does more paperwork than we do, but they keep it in a separate file. It's all on paper. I think that's FOIable personally if they pushed it, but so we just avoid that problem altogether. We will check you if you're wanted. You know, if you come in the building and you're wanted, we'll check that for you, because you got to deal with those warrant issues first. And as I mentioned before, it's not a get out of jail card. It's not designed to allow you to game the system, that type of thing. But we think it's a pretty good program, and that's our version of it. So it's a little different from the Gloucester Initiative. Again, the success is based on the fact that we have a volunteer group that's willing to spend the time, to make the effort, to find the placement, and they've gotten sophisticated. We've learned from Gloucester how to get our folks. They've eliminated the co-pays, things of that nature. Again, the only problem what we have now we face is we don't know what's a successful treatment program really looks like. The recidivism rate is very high. The failure rate is very high. I think it's like 17% success rate, you know, first time through. They've basically taken the alcohol model treatment, the 30, 45-day in-house, and applied it to drug addiction. But they think now, you know, an addict's mind is wired a lot differently than an alcohol-dependent mind is, and that model may not work. So we don't know, you know, if it's length of time or the type of intensive treatment that's involved and that type of thing that'll be working. That's probably our biggest, for our policymakers, that's probably the biggest challenge that they face, is to develop that type of program, to actually model out the correct program And then I think a pilot study will be needed. We did talk to one of our senators, made that recommendation that they consider funding a pilot study. New programs in the federal government are very hard to get through, so if they call it a pilot, it's a little easier sometimes to get the money. And I will tell you, we do all the other stuff that the other police departments do. We do have a regional community enhancement task force, that's what we call it, but it's basically essentially a drug squad. We're targeting the opioid dealers, the heroin dealers. Heroin's so cheap. It's so cheap. We've never seen anything like this. As the captain mentioned, our seizures are an ounces. When I was a young officer, we would never. If you seized an ounce, that would be a mother load. Today, it's pretty routine. Seizures of ounces of drugs. Ounces are a lot of drugs. A lot of drugs is an ounce of drugs. So. But it's very common, ounces and pounds. It's so cheap, and of course, there was in the medical community, and there's you can get Percocets for tooth extraction as young as age 11. You walk out with a 30-day supply. That's going to change. That's a cultural change. But in defense of the medical profession, and having come from a family of medical professionals, I have a daughter who's a physician, a wife who's a nurse practitioner. There was a time when pain was considered one of the vital signs. What you were graded on keeping your patients pain-free. And, there's Senator Blumenthal, I saw, introduce legislation to remove that requirement from all Medicare considerations, Medicare reimbursement considerations coming up. I think that's a good thing. Because you're not going to be pain-free. You want to be functional. You might be in pain, but you're going to be functional. But to be pain-free, you're on the path to addiction. And it's a problem. And the scary part is there are some people who, I listened to them talk, and somebody gave them 2 white pills to take for an exam they were stressed out about, and they fell in love with their with opioids. They're talking like immediate addiction. It sounds pretty scary. It's a pretty scary time to raise a child nowadays. So, but if you have any questions about our program, I'd be happy to take them. Yes, ma'am.
Is it only for the Groton area? People can they
We don't really.
Other places
Well,
in the state?
Well, Gloucester said, don't do what we did. Don't open it up, because they get people from Maine, New Hampshire come in. Says yeah, no, they literally have dad will come up, drive in from Maine, kick the kid out the door, and say, go in the lobby and don't come out till you're going to you got a bed in a treatment facility. But realistically, no, we'll help anybody. We'll help anybody. If somebody, again, we found that the families are our biggest path to. It's not the person who's addicted that's asking for help. It's the family saying, ask for help. Of course, our folks want to make sure that the person who's addicted, and I will say, in Gloucester, the term junkie is a pejorative. By policy, they don't allow their officers to call people junkies and things of that nature. They're addicted folks, addicted persons, and they need to be helped. And so we follow the same model, but of course that person has to want the help. And that the angels are given some training on their own as to how to determine that. Because again, we don't want to. I would say waste a bet, especially if it's going to be a scholarship, especially if we're going to send someone there where we have, where Perry is willing to fund that person's stay. We want to make sure the person has a reasonable likelihood of at least wanting to be opioid free. Yes, sir.
Do you also, in the Gloucester program, they're able to find the funds to give out Narcan free, or they have cooperatives with area pharmacies to be able to supply Narcan free of charge.
Yeah, the Narcan, we found that, by the time we went to Narcan, it went from $15 a dose to $50 a dose by the time we got it. So, there was a little price gouging going on. We got the local hospital is willing to get the programs up and running. Now, I don't know about, because the stuff expires every 2 years, so I'm good till the end of 2017. And I have to give a dose to each officer because I can't have it frozen in the cruiser, like in the wintertime, right? So you don't keep it in the glove box of the car, So it has to be in their gear bag so that it's ready to be used every time. So if if I have 30 officers, which I do, I have to have 30, we have 40, 50 doses, but because obviously they use them. But it's relatively easy to use. And as long as the person's breathing, it's like, we can't bring people back to life, if you're not breathing, it can't help you. We use the nasal Narcan. We don't use the injectable. We just dose them through the nose, and it's amazing. It's amazing. It completely blocks the receptors, makes them very angry, very upset. Took away their high instantaneously. So we have to be prepared for that. 45 seconds. It'll work. It'll reverse the effects of heroin. But it only works on opioids. There's a lot of other anti-anxiolytics and things of that nature. It doesn't work on that stuff. It only works on opioids. Any other questions? Thank you very much.
Thank you for coming. Thank you so much for coming and presenting some different ideas of what we can do together. This was, we had hoped to have an enforcement conversation. So I know we have some other officers from other towns. I don't know if you would be willing to share what town you're from and just if you have any statistics on heroin deaths in your community or strategies you're looking at taking for your community to address the crisis. Can I put you on the spot or?
Sure.
Okay. And if you wouldn't mind coming up and speaking in the mic, because we can pick it up.
Sure, I'm Don Melanson. I'm the Chief of Police for the Windsor, Connecticut Police Department. And along the lines with other law enforcement agencies, we're also going to be equipping our officers with Narcan. We're working with our health department, social services department to, again, perform a collaborative to find ways of reaching out to the community. We have had a couple forums within our community, also reaching out through our high school, through our SROs to provide education to the youth. And again, we haven't seen a large problem in Windsor with overdoses to this point. We have had a few, but nothing to the level of what Enfield or other communities have had. But we want to make sure we're in front of that curve and be able to provide the services that we can to prevent it from ballooning to a larger problem. We do have drop box for medications in our lobby, as most police departments do, and we also do drug take-backs, and we had one, I believe, last month. So, and we do that on a regular basis. So, again, I think, opioid overdose and, the issues that are surrounding, I think it affects every community. It affects all walks of life, from the most affluent people to, all the way through. All different levels. So it's non-discriminatory. It affects all people and all families. And as the chief had mentioned earlier, really, if there's a family here that, every family has in one way or another has been affected by this. And we do see that it does drive a large part of crime throughout. Many of the thefts, burglaries, etc., is driven by people who need to find funds to buy drugs. So it is an issue that it's prevalent amongst all law enforcement agencies, and we're looking to, again, along with everyone else, find a way to best deal with this. So, thank you.
Oh, okay. Thank you, Chief. Is the other law enforcement reps in the room? May I ask to speak a little bit?
How are you?
Good. Can you introduce yourself?
Sure.
Thank you.
My name's Tim Merrill. I'm with the State Police, Ellington Resident Office. Everything's pretty much the same that all the other officers, chiefs, and everybody said. The difference is with the State Police, all State Police detachments now have the drop box, whereas before we didn't. In any town that isn't run by a local police department, lots of times they were wondering where they could drop off their drugs and all this stuff.
Oh, can you speak in the mic, please?
I can. But one important thing with the state police, we have resident trooper programs where if you don't have a local police department, the troopers work in the town as if a local police officer. But the resident towns now have drop boxes, which helps with some of the citizens because they don't want to drive all the way to the local state police detachment. They can go in their local town. So I know Ellington now has it, which is next to Enfield and some surrounding towns. One of the things that the chief mentioned about crimes, that's one of our indicators. A lot of car breaks. A lot of people leave their cars unlocked at night. And we get a lot of people that call and they say, some change was taken. I don't really want to say much about it, but I just think you should know about it. So we kind of take that and some of us kind of map it out and talk to other towns and see if it's a common problem. We utilize that information, and lots of times down the road we end up finding out that it's related to heroin or some type of drug activity. And one of the things in Tolland that we have is the NET team, which is the narcotics enforcement team. And we work with other towns, states, and actually one of the slides that we had was from the NET team in Tolland. And all the resident troopers and patrol troopers and some towns participated in it as well. It's been pretty successful. We all kind of work together. I think that's the biggest thing here is it's not just a law enforcement thing. It's a community thing. It's a family thing. And if we try to find the best solution with law enforcement and the community, it kind of overall works. So anybody have any question from the state police side? Okay.
Great.
Thank you.
Thank you. It's great to hear from law enforcement. I see someone else in the back corner. Are you comfortable? I'm not sure what town you're from.
I'm with Windsor, and my chief already spoke.
You are with Windsor. Okay, you're all covered. Thank you. Any other questions for our speakers? If not, that kind of concludes our enforcement presentation today. So I want to kind of focus on moving forward. So we're going to break into subcommittee work over the summer. We're going to have prevention, enforcement, and treatment and recovery. And we have scheduled meetings. So if you're interested in one or more of those areas, please come to the meetings, because from those meetings we will really develop a needs assessment in terms of listening to what your needs are, and we will be committed to finding resources. We'll put together some kind of regional approaches and work together to move this work forward. So again, I would hope that some of you might be interested in taking a lead as a chair or co-chair in those committees. We'll take on a lot of the back work, like creating agendas and getting out minutes. You just need to be the key champion, the visionary that could move the work forward, and then we will support the work. We would like to continue maybe in September coming back quarterly. So as you identify resource needs in terms of information that might help build our capacity to address the subcommittee work, we will work hard to finding speakers to come in for trainings and sharing our work so we can stay coordinated and we can stay collaborative. So I hope that you will sign up for a committee. And moving forward, I just want to say a kudos to our prevention subcommittee. We are applying for a Partnership for Success grant through the State Department of Mental Health and Addiction Services. So I don't know that we'll get it, but again, we're committed to seeing if we can bring that resource into our region. And this week is our deadline, and we're like almost there. And I'd be willing to share any of the needs assessment, the write-up, and the budgetary process with any of the communities that would like to see it and to have a conversation about it. Be willing to do that. If you have any questions about it, I'll stay around and answer that. And I think that's it. Make sure you fill out an evaluation form. And we do have a list of topics that you guys were interested in learning about, so we'll make sure that we bring those ideas back to get future speakers for us beginning in the fall. Any questions? If not, thank you for coming. Thank you to our speakers. Appreciate your support and all your wisdom, and have a great day.